Helping Seniors Television, all about improving quality of life for seniors. If you're a senior, know a senior, or plan to be a senior, then this show is for you. It's all about helping you develop your own aging plan so you can age actively and with dignity. Helping Seniors Television from the Helping Seniors Network of information, education, and resources.
I'm Kerry Fink with Helping Seniors of Brevard Television. Thank you for joining us today. It's a pleasure to have you with us. I have the privilege of sitting in for Joe Steckler, our president and founder. And one of the things that he has always expressed from the very beginning, as you may know, Joe is the fellow who created the Brevard Alzheimer's Foundation here in Brevard County and created the thing which today they still call Joe's Clubs. It's the adult daycare centers, and not content to be retiring after successfully getting that whole thing going. He says, listen, we have to create an organization. I want to create Helping Seniors of Brevard. He said, because what I've come to realize is that seniors have many more issues that go well beyond memory limitations and issues that can happen there. And he said, so what I'd really like to do is have an organization, a not-for-profit, that can really delve into finding ways to help seniors with issues that go well beyond those of specifically memory care. And so here we are, we're entering our 10th year of service in Brevard County already with the Helping Seniors Network. We operate the county's senior information helpline, which you can reach at 321-473-7770. That's 321-473-7770. And over the course of these past, like I said, nearing 10 years now, we've helped more than 3,000 families with questions that regard everything from medical to legal to transportation or connecting to housing to all sorts of things that seniors run into. And today we have a rather unique show that we haven't really touched on this before, but it's an important show. And we're titling it Pulling Back the Curtain on Mental Health. And we're privileged to have in the studio with us today one of our Helping Seniors partners, Tracy Graff, who's a registered nurse, and she is the owner of Avid Home Care Services. Welcome, Tracy. How are you today?
Good, Kerry. Thanks for having me
Good.
again.
And you know, I think the inspiration for this came from some articles that you had presented in some print magazines in our area. And I thought when you were showing me that these articles are there, I thought this is an area we never really do talk about. We have done programs on pain management. In fact, some of the conversations that come up as people who deal with chronic pain are quite often suffering with depression and things like that. And I'm sure in your own experience over the years as being a registered nurse, you've run into lots of occasions for that. And I guess that's probably what prompted you to even write articles about this topic.
One of the things that definitely, I write articles in several magazines in the area. Merritt Island Now is where these came from.
Okay.
And, I try to write an article every month that targets an issue surrounding seniors and gives some more education on it. Mental health is something that people are very reluctant to talk about. I am also a psychiatric nurse, and being a home care nurse with a Medicare agency where, I went out and did psychiatric evaluations and made recommendations. I found that people were many times very, very confused about the subject, about how to get help, when to get help, when it's okay to have someone really committed to a psychiatric facility. And I just felt that it was really important to discuss it in some more detail. So I brought that and another article to discuss, to try to give some people more insight into what goes on when people are having issues that may border on dementia, but have some mental illness components to it.
And that's such an interesting thing, because I guess historically, from a novice's perspective, you would think, well, we get all our problems worked out younger in life, so by the time that we're getting older, we have a little bit better base to work from, and maybe these things are less prevalent. But from what you're describing, I guess it's really a thing that we probably don't talk about enough.
No, and what I have found in my experience as a psych nurse is that many times we will encounter elderly patients who are now living in an assisted living facility, say. And their children, they have dementia. They're not able to be good historians. They may never have disclosed to their children or family that that mom saw a psychiatrist every 2 weeks for medication and counseling. Psychiatric records are extremely protected, so they are not like medical records. They have to sign separate releases to get them, and even then what they get is limited.
Wow.
So yeah, it's kind of almost a little too overprotected in my opinion, because when it comes to that kind of situation, the medical field and the people who are now left to care for this patient really don't have all the information that they need.
Right.
I mean, in my own experience, I encountered a lady who was living in an assisted living facility, and they really didn't know what was going on with her, but they knew that she was disruptive and she was paranoid and she was seeing people, and I mean, the list just went on and on.
Right.
And, you know, they were calling it some kind of dementia and treating it with a very low dose of an antipsychotic. So at the time, that was my job, to go in and evaluate her and give my recommendation. And I knew upon meeting her immediately that she was a schizophrenic.
Aha, right.
She was absolutely a schizophrenic that was completely off the wall because she hadn't been medicated appropriately for however long. No one had been, she hasn't been taking her medicine, didn't see a psychiatrist, it's not in her medical records. And no one knows, is this dementia or is this something else?
You know, it's so interesting you bring that up. I'm thinking about a recent conversation we had with some experts who are part of the Helping Seniors Network about hearing aids. And one of the observations that they had made, which was kind of interesting because I never thought about that in that perspective, that oftentimes the symptoms for dementia are the same that you might have if you're not hearing somebody talking to you well. So they're taking your non-responsiveness and
correct.
But
exactly.
They're not hearing you.
Right.
And what you're saying is the same thing can happen in the psychiatric world. Somebody says, "Well, you have dementia," but they're not looking like there may be something else going on.
Right. And at Avid, in non-skilled home care, we find that we tend to get clients who, you know, maybe have been diagnosed with some type of dementia and maybe, that's a big maybe, are being treated for some type of dementia, but they're really having psychiatric symptoms that really should be treated like a psychiatric symptom.
Right.
Not like dementia.
Right.
So, you know, and it's tricky because some of the psychiatric meds that they use, the antipsychotics in particular, can cause deadly reactions in people with Lewy body dementia.
Oh, wow.
So when you have these people who have these unspecified dementias that aren't really nailed down with a diagnosis, people are reluctant to give those kind of medications.
And then what you're also bringing out, which I hadn't really thought about, because we're usually somewhat amazed that, you know, the whole point of having your medical records kind of organized so that if you had to be admitted to hospital, you know, they would know what you have. You're not supposed to put this medicine with that medicine or things like that. But you're adding a whole nother dimension when you start saying now we can't really access properly the mental health records. So I want to ask you, like, let's back it out to the layperson's perspective. How do we know signs and symptoms of a problem? Like, how do we know, like, should we be taking a look at this or considering if this is a mental situation as opposed to writing it off as dementia or something like that? Or are they just getting old and forgetful or
I mean, it's really hard sometimes because when you get into things like hallucinations, you know, people with dementia have hallucinations. Some types of dementia produce hallucinations. If you do your homework, they're pretty specific, though. People with Lewy body dementia tend to see cats and animals and children and hear music. People with schizophrenia have people talking to them.
Wow.
You know, literally like someone behind them talking to them.
Wow.
When they're talking to you. And what they're talking to them and saying to them can influence their behavior or their attitude towards you depending upon what the voices are saying. So it's very tricky sometimes. It's really about getting the proper help and the proper diagnoses that, you know, so that they can treat it the right way. But I experienced many times that exact situation where these people were in an assisted living facility. They were really having trouble controlling their behavior, and they couldn't understand why. And when you have psych experience and you meet them, you know right away that this is not hallucinations, dementia.
So that was actually going to be my question, is like, if you're the loved one, maybe, because this happens a lot with the calls we get on the Senior Information Helpline. I'm the adult child. My mom or dad is living down in Florida. I was down visiting over the holidays. I'm getting a little nervous because she's not answering questions well. I don't know what to do, who to call. Where as the concerned loved one, what steps do you say, well, this might be a way to start approaching that? You're starting to wonder about this. Maybe you should consider doing that part of it.
Well, if mom is, and this is kind of where the home care side comes in for us, is that, really having a regular caregiver who, even if they just stop in and see the client a couple hours a day or a couple hours 3 times a week, there's some regular consistency to it so that they get to know what that client's norm is, so that if their behavior is off, they recognize it.
So somebody that's kind of closer and seeing things on an ongoing.
And it doesn't even have to be a medical person. It could be a companion who just is coming to check in on them.
See, that's an interesting point you raise. We through the Helping Seniors Advocacy Council, I always have trouble with that word, Advocacy Council. We've done a lot of studies. In fact, we had a survey that we took countywide a couple of years ago where we asked people to rate what they thought the biggest needs for seniors in our area were. And of course, you would expect you're going to hear things like housing, transportation. What surprised me as a non-expert was when I saw jump up on the list was social activities, that it was very high on the list. It wasn't like 14, 15. It was, and as we dug into that question, we understood that there was an aspect of people feeling isolated. And that tags me to the part of the conversation I want to have. You wrote another article that I think is important for readers to access called Human Contact May Help Prevent Senior Suicides. And unfortunately isn't one of the possible outcomes of untreated issues with things that may be going on psychiatrically. That's where we could wind up if we're not careful.
Oh, definitely. I think that if you know an elderly person who is depressed and they're not being treated, I think you should not be so confident that they are safe.
You know, you wrote in this article, and you were talking about, because we don't often think about that, because we're so busy talking about seniors who are living longer and things like that, we don't talk about the statistics here.
When I did the research for that article and I found those statistics, I was shocked myself. The fact that men over age 65 are currently the largest group of suicides that happen in this United States.
See, nobody would think that.
No, you would not. I would not have thought it myself. And they believe that there are different factors that play into that. So, seniors definitely are very isolated sometimes. They may go days or even weeks without anyone physically laying eyes on them. That takes a toll on someone. That really takes a toll on people. And they may not get many phone calls. If they don't have family, or some of them even have a lot of family, they're just busy with their own lives. It really is a big problem, and it wasn't until I went into home care that I really was shocked, by the realization that many times some of these patients you're seeing, you are the only human contact they had for the whole week sometimes.
We were talking about that because we did a radio show not so long ago. Joe Steckler hosted this radio show that we do every Wednesday, and he'd actually brought in a couple of police officers from the Palm Bay Police Department, and they were the guests on the show, and they were talking about how they now have a program in that city of doing well checks, but they had a much nicer term for it than well check. They called it a hello neighbor, because
that's great.
And what they were talking about is that their experience is that so many times the senior is in their home alone, they can't get out, nobody comes to say hello to them, and they just really wanted to try to do something proactive to be going around and say, we're just here to say hello, how you doing, and to actually do that. And so, like, maybe technically it's called a well check, but it's really a Hello Neighbor program.
I think it's great to know that they have that program, honestly. I would use it if I had to use it.
Right.
But I do think that there are a couple other factors that play into it. Obviously, seniors are more frail than younger people. But I mean, the biggest shocking statistic about the age groups is that they said that 1 out of every 200 younger adults is actually successful at the suicide attempt, when 1 out of every 4 elderly adults is successful.
Wow.
And they believe that that is because of the isolation, the frailty, or other medical problems, and the fact that many seniors unfortunately plan out their suicides for an extended period of time without family realizing what they're doing.
Right.
If they're giving items away to you guys without any reason to be doing that, family, you should definitely be concerned. I mean, definitely. If they're not eating, if they're losing weight, if they're not, they show no interest in going out at all, not sleeping well is another big sign of depression. And I've met many senior citizens who will say to me, well, I'm not depressed. And I have a discussion with them about, well, do you eat right? Do you sleep well? And they don't do either one. And when I point out to them that those are some of the most common symptoms of depression, they're kind of surprised.
Right, right.
But I think those are very alarming statistics. Right. And in looking into it, I came across the second part of that article, which is based out of the United Kingdom, did a study on around 2,000 seniors. And they polled them and asked them a lot of different questions. And they were shocked to hear that most of them spoke to maybe 3 people a week, if that.
Wow.
All.
See, that's amazing. I want to come back and I want to talk about combating that a little bit, but before we get to that, I want to use a word that I only heard when it came into guardianship before, but it was one of the notes that we put down that we should talk about today, and it's Baker Act. And I don't think the average person, unless they've been involved in something that required that, I'd never heard that term before until we started talking about guardianship, and then it was like, what is this all about? So could you just kind of like explain Baker Act and how that applies, particularly in this conversation we're having?
So when there is concern that there is mental health issues that have gone beyond what can be handled outside of the home, and I will say this, that any elderly person that is having symptoms, even if they're acting like they're literally schizophrenic, their urine should be checked first.
Really?
Absolutely number one thing, their urine should be checked for an infection first. Because many people who are elderly have the symptom of we call a mental status change, and that can be small or it can be really bad when they get urinary tract infections.
Wow.
And many times they will present with that before they present with things like burning or pain when they're urinating.
Interesting.
So that should always be done first before any psychiatric help is sought. But I think that people get very concerned about a Baker Act. A Baker Act is what they call, here in Florida, it's an involuntary commitment.
Okay.
It's for a minimum of 48 to 72 hours here, I believe. And it can be initiated by a police officer, a doctor, in particular an ER physician. They say mental health professionals, which is kind of a vague term here, but that's what they say. So, what I have experienced is that when I have encountered a patient who really should be Baker Acted for their own safety, I have encountered families who are very reluctant to do it.
Well, it sure seems like, wow, we really have let everything out of the gate at that point.
So tell me honestly, as a layperson, what would be your reluctance? Would you have reluctance in that if I said to you, Kerry, we have to put your mom into circles of care for a few days.
I would think that it would be scary because we don't really know what that means. As the average layperson, we're like, I don't know. I know if the ambulance comes and says, mom's got to go to the hospital because there's something that's going on here, I can process that. But when you say, no, listen, we need to Baker Act mom, now I'm like, whoa, what is this all about?
Exactly,
Right?
but so I say to clients a lot, so what you're telling me is that if your mom had a medical emergency, that you would be comfortable with me saying she needs to go to the hospital, we need to call 911.
Sure.
And you would be comfortable with them taking her to the hospital, and you may not see her again for hours. I
Right.
mean, depending upon what's wrong, they could get her to the ER, need
Sure,
to
of
stabilize her,
course.
have you holding off before they let you in.
Right.
And you have no idea what's really going on during that
Right.
time. But people, not just yourself,
Yeah.
but people are comfortable with that. You say the same thing about mental health, and people just lose
Yeah,
it.
we don't understand. We don't understand that,
And that's a
it.
shame because what I say to people all the time is that they really should be treated like a medical emergency because they are an emergency. And when a medical emergency occurs, we send the person to the hospital, and we easily put the care of that person into the hands of the healthcare professionals.
Right. And that's really what you're saying. The point is, if we want to get to the root of this problem, we have to treat it just as seriously as we would somebody thinking, well, somebody may be having a heart situation or something else.
Right. Now,
Right.
realize that, and people don't realize that these psychiatric facilities, the intake facilities where you go in the first part of the whole admission is really just like an admission through an ER, except it's not for a medical problem.
Right.
And, I'm not going to lie. I mean, there are times that people need to be sedated and restrained
Sure.
for their own safety.
Sure.
If they're trying to hurt themselves or throw a stretcher or, we have to act to keep them safe.
Right. And isn't it true then, oftentimes when something horrible has happened, then somebody says, well, why didn't we catch these warning signs earlier? We
Totally,
should have
yes.
paid better attention and we missed that.
How did we miss this? And there are 10,000 red flags that have been occurring
Sure.
for 2 months that everybody ignored. And the primary care doctor, they don't even know it's happening. If the family doesn't share with the primary care that it's happening, they don't know what to think.
So this is an interesting pivot point because we just have a couple of minutes left on the show, but I want to circle back because I think one of the things that is a core root that we wanted to get into our discussion today is this issue of loneliness because it is pervasive and through all these things. And I think one of the things that you already, if you had an RX pad for this, I think you've already given a prescription, which is that this isolation business is a bad thing. And I think that takes us right back to what you do with Abbott Home Care Services from the standpoint that that's a thing that you can do that could put a spoke in the wheel to support good health at home, physical and mental. Because we understand we don't want
physical side.
mom to fall trying to change a battery
Right.
on a smoke detector or
Right.
things like that. But we often don't think about this other
Do
aspect.
we think about that mom hasn't been outside of her house for 5 or 6 months?
No, because it's out of sight is out of mind, right?
Exactly.
And so
And they feel like a burden. They don't want to say, well, can't somebody just come take me for a ride one
I want
day?"
to tell you a story. I was at a lunch meeting the other day where it was a group of seniors, and the lady was 89 and the gentleman was 92, and they talked in this group setting about the fact that they were fine. As they got older, they wanted to get some help in the home, but they did not want to burden their children. I think isn't that so often what part of it is? Oh, I don't want it. They're busy. I don't
Oh
want
yeah,
it."
right. They know that if they need them for physical things or for shopping or food or something, they know that they have to depend on them for
Right.
that, which means they're even less likely to say, "Hey, can we go to lunch?" or
Right.
"Can we take a ride to the beach?" or anything. And I think that many times when it comes to seniors, we do forget that it's not just about what their physical needs are. It's also about what their mental needs are.
And that's why the whole thing about this companion care and having somebody come into the home could be so important.
Sure. And I mean, for $20 an hour, you could have somebody come and take you for a ride, take you to Cocoa Village. We've had people, we've had staff take people to the Cocoa Village Art Show.
Sure.
Where did they go recently? The some seashell big thing in Melbourne. So, you know, it's and I think that honestly it makes my staff feel motivated to do good, to do things like, you know, I do love the campaign that part of my article, the campaign that came out of that study in the UK, which they call Donate Your Words. Wow. I mean, it's just such a simple concept to talk to people. If you see elderly people in your community, say hi. Right. Ask how their day is going. Compliment them on something they're wearing. If you see an older gentleman with a hat on that shows that he was a military something, thank him for his service.
Yes.
It means so much to them that you could make their week with a 30-second conversation in the Publix. So I think it's just important, and I liked that. I know the article was kind of sober about the suicide, but I liked that campaign, and I thought that it was important to sort of bring that to my own community and say, why aren't we doing this?
It's such a good point. We're about out of time on today's program, but I want to make sure people know how to get in touch with you to continue this conversation. So how do we reach Avid Home Care?
Well, the office number is 321-392-3400.
One more time?
321-392-3400.
Okay. And then you have a website too.
We do. It's www.avidhomecareservices.com. Avid is A-V-I-D.
And we're going to get these articles up online so you can reach these at the Helping Seniors website, because this is such an important thing that we don't talk often enough about. And these two articles, Human Contact May Help Prevent Suicides, and this two-part article called Pulling Back the Curtain on Mental Health. It's good stuff for us to know. Thank you for joining us today for Helping Seniors TV.
Joe Steckler, thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses, and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we would welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.